Dena is a therapy that I came across several years ago, and it is a system that's been put in place very scientifically. It uses a lot of sports medicine, and it allows me to get information on various pain patients. TMJ, migraines, just sore jaws, tinnitus or the ringing of the ears, those kind of things. And then from there, you break it down into treatment modalities depending on what your diagnosis shows you. So it's almost like a cookbook approach, and I felt really good about that. It's shown very good results, and it finally gave me a way to help these patients where I always wanted to, but just felt very inadequate in that treatment other than just very basic treatment. We incorporate a tech scan, which is a computer analysis of your bite, which lets us see if you're balanced or unbalanced, and so we will adjust that accordingly as we need to. It also involves cold laser, ultrasound, and microcurrent. And those things, the cold laser, the ultrasound, work to help relax muscles and get rid of any kind of spasms and things that you have in your muscles, and which then lets the jaw relax and go back to a more normal position. Because so much of what's happening is not just the joint, it's what's happening, what are the muscles doing to move the jaw to different positions. And so you got to treat the whole thing. It's not just the joint in your bite, it's the muscles and what they're doing. You can have referral points so that I can press here and find a trigger point, which is like right there. And if I hold it and press on it long enough, it'll start giving me a headache up here. And so those are referrals. So you have to treat this as well as the jaw. And initially we have to treat the muscles to get them out of spasm, so that then things will relax and the jaw will start going to its more normal position, and then we'll start treating the bite. We also use a splint, so we're using some conventional therapy for TMJ, which having them wear an appliance at night, which is part of the therapy. So it is a well-rounded approach, and that's what's really excited us, that we've got something that we can say, yeah, we do our diagnostics, these are the symptoms, this is what we're finding. They go into level 1 or they go into level 2, and then we know exactly how to treat them, how many steps, how many weeks is that going to be. Sometimes it takes longer for some of the very advanced cases, but we've been doing it for a little over a year now, and we've just seen some phenomenal results.